My name's Carolyn Ehrlich. I'm a research fellow with the Centre for Community Science, which is part of Griffith Health Institute. I became interested in research as an alternative to a clinical career. I had a long clinical career and I was interested in trying to find ways of affecting clinician behaviour, but in a different way. So using research and an academic background to inform clinical practice rather than working clinically on the ground. My research interests are twofold. First, I'm interested in understanding complexity within the healthcare system, working with people with complex healthcare needs and their complex social situations that they live in, and understanding that and working with people on that level. And secondly, it's about I'm interested in translating new practices and for new practices to become embedded as ways of working for clinicians. So often we find that with translational research, people talk about translating benchtop science into new ways or new medicines, that kind of thing. I'm interested in translation research or implementation research from the perspective of how to embed new ways of working for clinicians. The research outcomes that I think have got the most benefit to the communities that I work with is that when we're able to assist clinicians to work in new ways, when we're able to help them to embed those new ways of practicing into their daily work routines, that the real outcome that we're achieving is better health outcomes for patients, better care for patients or clients or the individuals that are being provided with healthcare, and that the care that they get is more responsive to their needs. I think that the key issues with the research that I do into the future are to find ways of working with the translation of research into practice, to reduce the gap between the theory that's known and the actual practice, so that theory-practice gap, and dealing with that. But I think that Griffith is well placed to be involved with that kind of research. I think that we have beneficial multidisciplinary teams or transdisciplinary teams. I think we have research teams that are able to work across many areas of healthcare practice and are quite familiar with and able to work with the complex nature of the healthcare system.